Today we are going to start Daimai channel. Daimai or girdle vessel. So there are 8 extraordinary vessels. In the previous class, we have already discussed Chongmo. We have discussed yin and yang heel vessels. We have discussed yin and yang linking vessel. Today we are going to discuss Daimai. So this is the 6th number vessel which we are going to discuss. After that, only rain and the dew will be discussing. The another name of the Daimai is girdle vessel. इसका नाम girdle vessel भी है. The Daimai is like a belt meridian. जैसे हम बेल्ट लगाते हैं, ये बेल्ट की तरह है. It's like a belt. So it is called girdle vessel. The master point is gallbladder 41 and the couple point is triple warmer 5. हमारा gallbladder 41 मास्टर पॉइंट है और ट्रिपल वार्मर 5 कपल पॉइंट है. The gallbladder 41 is very important points. And it is the master point. Okay. And the triple warmer 5 will be the couple point. The concept will always remain same. For the male, master point will be on the left side. And for the female, master point will be on the right side. हमारा कंसेप्ट वही रहेगा कि मेल में है मास्टर पॉइंट राइट साइड में लगेगा और फीमेल में मास्टर पॉइंट लेफ्ट साइड में लगेगा. Sorry, in the male it is on the left side and in the female it is on the right side. फीमेल में राइट में और मेल में लेफ्ट में और कपल पॉइंट दूसरी साइड में. बी ऑलरेडी नो दिस कंसेप्ट. So we already have discussed about the Chongmo. हम चोंगमो के बारे में डिस्कस कर चुके हैं. But we have discussed. Okay, Daimai. The Daimai, also called girdle vessel, the master point is gallbladder 41. This is the master point. And the couple point will be triple warmer 5. And the Daimai is having connection with the pituitary gland. Daimai का संबंध हमारे पिट्यूटरी ग्लैंड से है. इसका अर्थ है कि वेन जब हम गॉलब्लैडर 41 को स्टिमुलेट करते हैं, ये हमारी पिट्यूटरी ग्लैंड को एक्टिवेट करता है. इट्स एक्टिवेटिंग अवर पिट्यूटरी ग्लैंड. द एंटीरियर पिट्यूटरी इज हैविंग कनेक्शन विद द सीबी मेरिडियन. द पोस्टीरियर पिट्यूटरी हैविंग कनेक्शन विद द डीयू मेरिडियन. And if we see anterior plus posterior pituitary, entire pituitary having connection with the Daimai vessel. तो anterior pituitary को हमारा सीबी मेरिडियन नियंत्रित करता है और posterior pituitary को डीयू मेरिडियन नियंत्रित करता है और डायमाई हमारे पूरे के पूरे pituitary को नियंत्रित करती है. Right? So it's a very important vessel. In general, I will tell you right now, we will be discussing the root. It's also working on the outer leg because of the root of the gallbladder meridian. We already know the gallbladder meridian passing from the lateral side. हम जानते हैं कि gallbladder meridian हमारे लेटरल साइड से ट्रेवल करता है। सो इट्स वर्किंग ऑन द आउटर लेग, लेटरल लेग, इट वर्किंग ऑन द बेस्ट रीजन, ये हमारे बेस्ट रीजन पर वर्क करता है। इट वर्किंग ऑन द हिप एंड द जेनिटल्स, ये हमारी हिप और जेनिटल पर काम करता है। अभी हम इसका डिस्कशन करेंगे, सो डोंट वरी फॉर दैट। ये तो एक जनरल बात थी। ओके, लेट्स सी द डिटेल ऑफ डायमाई बेसल। चलिए अब हम इसकी डिटेल देखते हैं। द डायमाई बेसल is called girdle vessel or belt channel because it's like a belt. ये हमारे बेस्ट को इंसर्कल करता है। इट्स इंसर्कलिंग द बेस्ट like we are wearing a belt. Now remember one sentence. It store excess energy which might be physical or the emotional. इसमें हमारी एक्सेस एनर्जी स्टोर होती है। फिजिकल एनर्जी हो सकती है, इमोशनल एनर्जी हो सकती है। सपोज समवन इज होल्डिंग लॉट्स ऑफ ट्रॉमा, समवन इमोशनल ट्रॉमा, किसी के अंदर बहुत ज्यादा इमोशनल ट्रॉमा अंदर स्टोर्ड है। नाउ द पर्सन इज हैविंग लॉट्स ऑफ डिपोजिशन, लॉट्स ऑफ स्टोर्ड some physical trauma, emotional trauma, physical issue, emotional issue, and person is not able to let go. व्यक्ति के अंदर जो जम गया है, मे बी इट्स अ फियर, मे बी इट्स एंगर, मे बी इट्स abusement. So sometimes because of this trauma, person is getting, females are getting irregular periods, painful periods, lower back pain, even male are getting, male and female, anyone might get some problem. It might be in the stomach, it might be in the upper body, it might be in the lower body. So number one, it releases the excess energies. So due to the suppressed emotions, suppressed experiences of the life, okay, you are not having enough time to deal with the issue and you are not able to deal the issue and you are not having willingness to let go. कभी कभी ऐसी चीजें होती हैं कि हम उन्हें let go नहीं कर पाते। कोई कोई ऐसी चीजें होती है हमारी लाइफ में कि हम उसे लेट गो नहीं कर पाते। वी आर नॉट एबल टू लेट गो some issue and they are continuously bothering us, troubling us, like maybe the death of some loving person of your family. You are not able to let go this, like breakups, divorce, or sometime your partner, some partner is sudden accident or death, or anything which is unexpected, like failure. Person was preparing for the medical exam, IIT exam, or some other exam, and continuously failure. So lots of issues not able to solve these issues, and it is depositing inside the body in the form of trauma, emotional trauma, or some physical trauma also. Like suddenly someone got electric shock in the childhood. Now throughout the life, he is feared with the electricity. Someone fall down from the height and got some trauma. Now the trauma is stored throughout the life. When the person is going on the height, suddenly start getting giddiness. कोई गिर गया ऊपर से, अब ऊपर जाता है तो उसे चक्कर आते हैं नीचे देखकर। ये किसी भी लेवल का हो सकता है। I will tell you one person was, as soon as he was seeing the flowing water, एक व्यक्ति जब भी बहता हुआ पानी देखता था तो उसे इपिलेप्टिक फिट्स आने लगते थे। One person was getting epileptic fits after seeing the flowing water. Every time, if you see the river, if you see the any like canal and some flowing water, he used to get epileptic fits. No one was able to diagnose what is the reason. Okay. Doctor has given beautiful name hydrophobia, कि पानी से डरता है. Hydrophobia. What is the reason? Since the childhood he has not got any such experiences. बचपन से तो उसे कोई ऐसा experience हुआ नहीं. So we have three different vessels for the pituitary. One for anterior pituitary, one for posterior pituitary, and DIMI is for both anterior plus posterior pituitary, the combinations, right? So DIMI can be used for both. And for the anterior pituitary, we can work on the CB meridian. And for the posterior pituitary, we can work on the governing vessel meridian. So in the Taoist, there is an abdominal massage just to release the emotions, just to release the trauma, right? It's a wonderful for removing the stagnation, even doing the abdominal massage. So suppose one person is having some issue and not willing to let go, because कई बार हम ऐसी चीजों को छोड़ नहीं पाते, छोड़ना चाहते हैं लेकिन नहीं छोड़ पाते. Like today one female patient came, her mother is got nervous breakdown, and see the mother of that patient is taking lots of psychiatric medicines. So just by seeing the mother, this patient, the lady patients, got depression. अपनी मदर माँ को देखकर उसे डिप्रेशन जैसा आ गया. Because mother since the 5 years, since the 4 or 5 years, under the psychiatric treatment, after the nervous breakdown, without the medicine, she can't perform anything. So she told me, she also having too much concern for the mother, also having this concern that whether I will get this because of heredity, क्या मुझे भी होगा ऐसा कुछ. Then I convinced, okay, don't worry, it will not happen with you. I don't know whether it will happen or not, but I told it will not happen with you if you follow few things. तो ये लेडी को आंखों के नीचे डार्क सर्कल्स आ गए, ये सोच सोच के कि मेरी माँ का क्या होगा और क्या मुझे भी आ जाएगा. So sometimes we are not able to let go many issues. During that time, we have to work on the gallbladder 41. And if the female has abused by someone, even male and female, anyone abused by someone sexually, gallbladder 41 is the one of the great point to deal with, right? Because the lots of emotion are stored in this belt meridian. Belt meridian become very tight if the person is sexually abused. So gallbladder 41 will be working for excessive emotions and whether they are physical or the emotional. Now the many common names like a belt channel, holding channel because it's holding the emotions, vessels of latency, and the sea of Ming Men. ये सारे इसके नाम हैं. They are the synonyms. The master point is gallbladder 41, and the couple point is triple bomb of 5, and the starting point is gallbladder 26 or liver 30. Many authors are telling that it is starting from the floating ribs. हमारी जो floating ribs होती हैं, the 11th and 12th rib are floating ribs. So from it is starting, then it's encircling around, गोल गोल घूमता है. Then there are many points coming in the chain. बहुत सारे points chain में आते हैं. So we can see the internal pathway of the dimide channel. So we can see the liver 13. We can see the gallbladder 26, gallbladder 27, gallbladder 28. We can see all the points. So liver 13, then gallbladder 26, 27, 28. So it's originating from the liver 13. Then encircling and going through the gallbladder 26, gallbladder 27, gallbladder 28. Right. Then the key point definitely liver 13. Are the many other points coming in the entire belt area. In the front side, navel region. At the navel region, we have RAN 8 and the kidney 16 point. On the back side, there is some bladder points and the DU4. So it's making the encircle around the Ming Meng chakra. Ming Meng chakra के पास से ये पूरा सर्कल बनाता हुआ आगे नाभि से आता हुआ ये पूरा का पूरा घूमता है. Right. So you can consider very simply, in the front side, it's crossing the navel. In the back side, it's crossing the Ming Meng chakra or the governing vessel 4. In the front side, it's crossing the navel. This is the navel. So this is a RAN 8. Then the kidney 16. On the back side, it's on the governing vessel 4 and bladder 23. So governing vessel 4, then bladder 23, then bladder 52. Right. And on the side here, it's crossing this boundary of the iliac crest, iliac bone. So gallbladder 26, 27, 20, 26, 20. So it's having very wonderful circle. So now let's see a few points first. एक बार हम कुछ point देख लेते हैं. So first I would like to tell you the location of liver 30. So this is the liver 30. Liver 13 is the point. located on the tip of 11th rib, which is called floating rib, जिसे हम floating rib कहते हैं, right? How to locate this point? Easiest method to locate is this technique. Where elbow is touching the body, there you have to feel the 11th floating rib, the tip of 11th floating. So wherever you find the tip of the 11th floating rib, at the level of elbow, that is the location of liver 13. यह हमारे liver 13 की location है. So let's see now. We can feel the tip of the 11th floating rib here. So we are searching. We are going from the margin and reaching on the 11th floating rib. Or this is the another way, anterior axillary line. This 11th floating rib found in the anterior axillary line. What is the meaning of anterior axillary line? I will tell you. So let's see now. So this is the axilla. So this is the mid axillary line, who is coming from the center, anterior axillary line, and the posterior axillary line. So if we draw the three line here, mid axillary line, anterior axillary line, posterior axillary line. So from the anterior part of the axilla, if I draw the line, 11th floating rib will be there, right? So there are many methods to find out this point. इसको पता करने के कई मेथड हैं. Ultimately, we have to reach on this point, and we can consider from this floating rib area, our diamond channel is starting. Then the next point will be gallbladder 26, 27, and 28. अब हम आपको दिखाएंगे 26 point. So let's see in this image. We are seeing the liver 13. Liver 13 is the point on the 11th floating rib. Just below this is the point which is gallbladder 26. The gallbladder 26 exactly at the level of navel. हमारे नाभि के ठीक लेवल पर होता है gallbladder 26, ठीक liver 13 के नीचे, exactly below the liver 13. So we will find the liver 13 and we'll go to the gallbladder 26. So this is the liver 13, the tip of the 11th floating rib. From there we go one little down at the level of navel. This is the gallbladder 26. We can do the needling downward. We can see here in this image, it is at the level of navel. So gallbladder 26 and the liver 13 are just next to each other. So this upper point is liver 13 and the lower point is gallbladder 26, which is at the level of navel. Now our divine channel will be crossing going like this from both the sides. So now it will go to the gallbladder 26 to 27, then gallbladder 28. So let's see the next point, that is gallbladder 27. So this is the point, gallbladder 27. It's a very easy to locate. I will tell you how to locate. So we can see one prominent part here on the iliac bone that is called ASIS or anterior superior iliac spine. हम यहाँ पर एक उभरा हुआ हमारी ये iliac bone है. And the front part that is called ASIS, anterior superior iliac spine. The tip of this is called gallbladder 27. Anterior superior iliac spine. The another way to find out this point, दूसरा तरीका है इस point को find out करने का. You find out the RAN4. आप RAN4 को find out कर लो, CV4 or the RAN4. At that level, this point is located. Then feel the bony prominence on the iliac bone. तो CV4 को कैसे ढूंढेंगे? It's a very simple. CV4 is located 4 finger below from navel. CV4 4 finger below or 3 chin below. So this is the navel. From the navel, if I go 4 finger or the 3 chin, that is the location of CV4. At the level of CV4, I can feel the bony prominence, that is the ASIS, gallbladder 27. So liver 13, gallbladder 26, gallbladder 27. Then further we'll go to the gallbladder 28. Let's move to the gallbladder 28. अब हम जाएंगे gallbladder 28 पर. So let's see now. अब आपको gallbladder 27 मिल गया है. So we can see here, this is the gallbladder 27. From there, half tune in, half tune down. Go half tune in and half tune down. That is gallbladder 28. gallbladder 27 से आधा चुन अंदर आधा चुन नीचे जाओगे तो मिल जाएगा आपको gallbladder 28. So let's see now. We are searching the ASIS or the gallbladder 27. From there, we have to go half tune in and half tune down. So that is the gallbladder 28. So this is the gallbladder 28 point. ये हमारा gallbladder 28 है. So gallbladder 27 is here. And from there, half tune in and half tune down. That is gallbladder 28. Still we are on the border. हम अपनी bone के border पर ही चल रहे हैं. So we can see this is the bony iliac bone. So the step is gallbladder 27. And from there, we have to go half tune in, half tune down. That is the gallbladder 28. So now in this image, we can see here, the liver 13 is here. This is the liver 13. Then just down at the level of navel, that is gallbladder 26. Then we are coming to the ASIS. That is the gallbladder 27. Gallbladder 27. Then gallbladder 28. So this is the diamide channel. Actually, this channel is not like this. This channel is little like this. But this image is not that much appropriate. But whatever, but these are the points. After that, it's going to the navel, meeting to the navel. So working like a belt. So here meeting with kidney 16 and the central CB8. इसने पूरा आगे बेल्ट जैसा बना लिया और एकदम इसको टाइटली कस दिया. So now you can understand. If we do the abdominal massage, first you do random 5-minute massage. Then you do 1 minute proper massage on each point. Just liver 13, gallbladder 26, 27, 28, kidney 16 and the navel area. Only 6 points in the front side. We will able to release lots of traumatic emotions, which is creating problems. Right? Even you can do for yourself. आप खुद के लिए भी कर सकते हो. Even we can put the needles. We can put the needles in all the points. So now see here. It's originating from the liver 13, running through gallbladder 26, 27, 28, meeting with the RAN 8 and the kidney 6. The front root is over. And the back side, it will meet with the Ming chakra. हमारे पीछे अब ये Ming chakra से मिलेगा. So we can see from the liver 13, it's going on the back side to meet with the Ming chakra. So let's see the Ming chakra. So for seeing the Ming chakra, we have to see the lumbar 2. अगर हम lumbar 2 को देखें, this is the lumbar 2 vertebra. Below the lumbar 2 vertebra, this is the governing vessel 4, which is called Ming chakra, and 1.5 tune, that is the bladder 23, and again 1.5 tune, that is bladder 52. So now it is connecting with on the back side with this. So now you can consider if we are putting the gallbladder 41, it will also work for the back pain. ये back pain पर भी काम करेगा. How it's connecting all the points on the back side. Let's see here. On the back side, it's having connection with the DU4 or the Ming chakra, bladder 23 and the bladder 52. So from the liver 13, one branch going here, one branch going here. Liver 13 on the side, one branch going in the front side, one branch going in the back side. So making the entire circle. Now let's see here. So DU4 is the Ming chakra, which is located below the lumbar 2. So how to locate the lumbar 2? This is the DU4. For locating the DU4, we will search the lower margin of the ribs. This is the lower margin of the ribs. We will draw the line and we will go above, that is a DU4 point. One finger above, that is the D4 point, or called Ming chakra. From this Ming chakra, if I go 1.5 chun on the right side or the left side, so that is the bladder 23, exactly at the level of governing vessel 4. So this is the governing vessel 4. From there, if I go 1.5 chun right and left, that is the location of bladder 23. And if I go again 1.5 chun, that is the location of bladder 52. So bladder 52 is 3 chun apart from the governing vessel 4. हमारे governing vessel 4 से ये 3 chun की दूरी पर है. So that is the bladder 52. We can see here, this is the point. So now in this way, we can work very nicely to improve the kidney essence, kidney energy. We can work on the lower back pain, leg pain, knee pain, all the pain happening anywhere in the body due to kidney deficiency. So we can see this is the governing vessel 4, this is the bladder 23, and this is the bladder 52. So this is the complete route of the डायमाई चैनल. ये हमारे डायमाई चैनल का पूरा सर्कल है. So in the Pulse Classic, it's mentioned the diamond channel starts from the free floating ribs. ये हमारी free floating ribs से start होता है. Okay. So now, as soon as we activate the diamond channel, it will work on the many conditions. I will tell you, like it will work on the gallbladder issue, liver issue, kidney issue, spleen issue, stomach issue, bladder issue, any organ available there. It will work on the uterus. ये uterus पर काम करेगा. It will improve the legs. It will improve the abdomen. It will improve the hips all over. Whether the person is having pain in the lumbar region or the fullness in the abdomen, चाहे पेट में भारीपन है या कमर में दर्द है, whether the female having leukorrhea, uterus problem, gynecological issues, whether the person is having any problem in the leg like muscular atrophy, any type of the weakness in the lower limbs or motor impairment, and it will expel the dampness. Dampness को निकालने के लिए बहुत ही गजब का पॉइंट है. And it will improve all the yin meridian of the legs. So it's a wonderful. Gallbladder 41 को आप जैसे लगाते हो, ये पूरी dampness को ठीक कर देता है, menstruation को, abdomen को, कमर को ठीक कर देता है. It release all the stored issue. ये सारे stored चीजों को release कर देता है. One very important thing here, we know the gallbladder channel coupled with the triple worm 5, जो हमारा gallbladder channel है, वो ट्रिपल वर्मर 5 के साथ कपल करता है. Here dimer is If the person is struggling with any issue in the present, अभी परेशान है, प्रेजेंट में कोई इश्यू चल रहा है, व्यक्ति बहुत परेशान है, द पर्सन इज स्ट्रगलिंग अ लॉट एंड हैविंग lots of difficulties, lots of problems, lots of physical, emotional trauma, pain right now, we can work with the help of this. हम इससे काम कर सकते हैं, right? It's a wonderful channel for us. Dampness is the key. एक बात ध्यान रखें कि डैम्पनेस हमेशा डाई चैनल में स्टोर होती है. इट हैज बीन टोल्ड, अगर कोई व्यक्ति इमोशनली स्ट्रेस लेता है, द पर्सन इज हैविंग इमोशनल स्ट्रेस, liver and gallbladder is hyperactive, they will attack on the spleen and stomach and creating the dampness. जब कोई व्यक्ति इमोशनल ट्रॉमा का शिकार होता है, जब कोई व्यक्ति बहुत इमोशनल सप्रेशन करता है, द पर्सन इज हैविंग लॉट्स ऑफ इमोशनल सप्रेशन, देयर इज अ लिवर स्टैग्नेशन, लिवर ची स्टैग्नेशन, so which will attack on the earth element on the spleen and stomach, and there is a formation of the flap. हमने देखा कि कैसे डायमाई चैनल लिवर को भी क्रॉस कर रहा है, नेवल को भी क्रॉस कर रहा है. So liver is attacking on the spleen, it will balance the liver. So it will, because if the liver is attacking on the spleen, then spleen will make phlegm. स्प्लीन अपना काम ठीक से नहीं कर पाएगी. स्प्लीन का काम है ऊर्जा का निर्माण करना, हम जो भी खाना खाते हैं उससे ऊर्जा का निर्माण करना. लेकिन अगर स्प्लीन के ऊपर आक्रमण हो गया तो स्प्लीन ऊर्जा का निर्माण नहीं कर पाएगी, परिणाम स्वरूप फ्लेम बनेगा. So because of the liver chi stagnation due to some emotional issues, emotional suppressions, as soon as the liver is overacting on the spleen, spleen will not able to work normally, and in the result there is a formation of the flame. Because if spleen is good, working nicely, there is a formation of the energy, but if spleen is not good, then there is a formation of the flame. So as soon as we work on the dynamite, it will balance the liver, it will balance the gallbladder, then spleen will be calming down. Now no one is attacking on the spleen, then spleen start creating energy again. हमने जैसे लिवर गॉलब्लैडर को बैलेंस कर दिया, डायमाई is the best channel to balance it. Even you massage it without needling also, even you massage it, means all the points, and you can see the very wonderful effect. It will remove all the blockage, whether the blockage made by flame, blockage of the chi, stagnation, and there is free flow of the energies. Yeah. Yes, massage is very, very effective, no doubt. Massage is one of the great thing. So now we can see here, if we talk about the liver 13 point, liver 13 point, if the liver is overacting on the spleen, so with the help, with the stimulation of the liver 13, with the massage of the liver 13, or we are using the liver 13 points in the treatment, we can help the spleen. हम spleen को help कर सकते हैं. The gallbladder 26 just below the liver 13. Next point, we are using this for most of the gynecological conditions like white discharge, leukorrhea. That is due to because of the flame. जब lower part में flame ज़्यादा हो जाता है तो leukorrhea होता है, white discharge होता है. There is a fungal infections in the cervix or the vagina because of the flame there. So gallbladder 26 is very helpful for the gynecological problems or for the uterus, and It will help in the damp heat in the lower ZIO. Galway 27 is the point on the ASIS we have seen. It will also work on the local area like the uterus, like the prostate. So very good for leukorrhea and the local area, any uterine problem like the uterine prolapse, hernia, and there are many more like we have seen the effect distally also. And Galway 28 also very effective for clearing the emotional block and the local stagnation. So we have seen this is the root. So liver 13. So we can help the spleen and the stomach. So they will start making normal energy and will not make phlegm. Gallbladder 26, 27, 28 for gynecological issues. So in this way, this channel is very much effective. Now, see a few more things about this. The master point is gallbladder 41. And the couple point is triple gallbladder 5. So let's see the master point here. So how to see the master point gallbladder 41 between the fourth and fifth metatarsal bone we can see here. But see properly. There is a one tendon here. If we can see this tendon, we can feel this tendon. By stretching the leg, we will able to see this tendon. We will palpate this tendon on the back side. That is the gallbladder 41. इस टेंडन के पीछे हमारा गॉलब्लैडर 41 है. ध्यान रखिएगा टेंडन के आगे गॉलब्लैडर 42 है. On the back side of this tendon, we can see here, on the back side of this tendon is gallbladder 41. On the front side of this tendon, gallbladder 42. So make sure that you are putting the right one. So let's see here. Look at my leg here. Look at the leg here. Can you see my leg? Now, if I extend my small finger, I can see this tendon here. On the back side of this tendon, this is the location of gallbladder 41. ये हमारे gallbladder 41 की location है. You have to see this tendon. And this is the location of gallbladder 41. And we will put the needle here. Make sure you are not going in the front side. Otherwise, it will become gallbladder 42. Regarding the, so we have seen on the back side of the tendon, there is a gallbladder 41. On the front side of the tendon, there is a gallbladder 42. Got it? And the couple point is triple bomb of 5. So triple bomb of 5 is here. Let's see here the location of triple bomb of 5, which is the couple point. So it's a 2 चुन proximal from the wrist. हमारी कलाई से 2 चुन की दूरी पर पाया जाता है. From the wrist, if we go 2 चुन proximal, this is the location of Sanjay of 5 or the triple bomb of 5 exactly in the center. So here, if from the wrist, if we go 2 chun, this is the location of triple bomb of 5. Okay. So we have to put the point. Okay. Now audible? Audible? Yeah. So when the person is having hyperactive liver, which might create many problems like create high blood pressure, headache, chest pain, or any condition, lots of anger. So if you want to calm down the hyperactive liver, we will use this gallbladder 41 and triple warmer 5. It's a wonderful point combination. So gallbladder 41 tone and the triple warmer 5 sedate, and we already know for the male female concept what I have to do. हम जानते हैं. So most of the time when the person is having hyperactive liver, there will be temporal headache. So we can see if the person is having lots of anger and the temporal headache, we can use diamide channel. हम diamide channel का प्रयोग कर सकते हैं. So gallbladder 41 and triple warmer 5 can be used for this concept, right? Now, we already have seen, okay, other than the liver, now let's someone is having gallstone pain. Gallstone pain is called damp heat in gallbladder. So we already have discussed, we can work on the dampness, we can work on the heat. Why this? So we can work with the help of this protocol, gallbladder 41 and the triple warm of 5, right? And definitely we can add abdominal massage. But if the person is suffering with the pain during that time, we can't do abdominal massage. Right? We can put the point in the sujok, but we can't do abdominal massage if the person is having severe pain. If the person is suffering, अगर किसी व्यक्ति genital part की कोई problem, the person is having damp heat in the genital part, so it will create itching in the groin region. उसे groin region में खुजली मचेगी. During that condition also, we can work with the help of this. The damp heat in the genital part will create the itching in the groin region, and if the damp heat in the urinary bladder, it will create urinary tract infections. So we can work for the urinary tract infection also, or the burning urination also. हम burning urination के लिए भी इसका प्रयोग कर सकते हैं, right? As we already told you, the gallbladder meridian is the meridian of the lateral side of the leg. So the lateral side sciatica pain or numbness in the leg, or there is a motor impairment in the leg, we can use this. अगर किसी को मोटर इम्पेयरमेंट है, हम जानते हैं कि मोटर इम्पेयरमेंट है, लेग है, पैरों में नमनेस है, या फिर उसे लेटरल साइड का साइटिका का पेन है, हम इसका प्रयोग कर सकते हैं. The tight muscles of the lateral side, we can do the treatment using this, right? If the blood supply of the leg is not enough, If the chi supply of the leg are not enough, we can bring the good supply by gallbladder 41 and the triple bone 5. If the blood supply on the leg is not enough, they might create purple leg. If the chi supply of the leg are not enough, they might create cold feet or the cold leg. So we can bring the normal energy again, and we can bring the normal heat again in the legs by using these points, right? So now, if the person is having any type of the pain, the person is having lower back pain, and we already have seen the belt meridian is supplying governing vessel for UV23, UV52, and it's having very deeper connection with the Ming Meng chakra. It's helping improving the kidney, so it's also working for the lower back pain. ये हमारे lower back pain को भी ठीक करता है. Okay. If there is any problem in the breast pain, कमर का दर्द, we can definitely use this point. Now, the gallbladder is the meridian which is very deeply connected with the joints and especially diamide channel. So when the person is having deposition of the flame in the joints, जब ये हमारी फिंगर के joints में flame का deposition हो जाता है, so it start deformity and the pain like we see in the rheumatoid arthritis patient, or the patient suffering with the gout, we can see the deformity of the finger, उंगलियां टेढ़ी पड़ने लगती है. So we can use this channel, we can work for the flame, we can work for the gout, we can work for the deformity and the pain. उंगलियां टेढ़ी हो गई, क्योंकि उंगलियां टेढ़ी क्यों होती है? क्योंकि हमारी उंगलियों के अंदर जब फ्लेम जमा हो जाता है, उसमें एक्यूट इन्फ्लेमेशन हो जाता है, फ्लेम जमा हो जाता है, यूरिक एसिड क्रिस्टल जमा हो जाते हैं, तब हम इसका प्रयोग कर सकते हैं. I already told you when the liver yang is very high, which is creating high blood pressure and the headache, we can use it. जब liver yang high होगा, तब हम इसका प्रयोग कर सकते हैं. So when the gallbladder 41 and the triple worm of 5 combination is very much useful for the skin disease, especially allergic skin problem. What is the meaning of allergies? The meaning of allergies. What is allergies? Allergies means immune response. Immune response. So your immunity is making some allergy. Your immunity is making some antibodies. Maybe you are allergic to the sabun soap, you are allergic to some chemicals, you are allergic to the pollen grains, you are allergic to some special type of the clothes. Your body is making some antibodies, right? So with the help of this gallbladder 41, we are activating the pituitary gland and we are working on the allergies, especially allergic skin problem. तो किसी को खुजली आती है और ऐसी खुजली बहुत तेज वाली खुजली भी आती है, उसमें भी हम इसका प्रयोग कर सकते हैं. We can work on this. So gallbladder 41 is very much effective. The person is having too much anger, irritability, we can help this. If the person is very aggressive, having too much anger, irritability, we can calm down the liver yang by this combination. So we can definitely use this. In the acupuncture, it's very clearly mentioned for the unmarried female, This is a very excellent point because we already have seen how it's controlling the uterus, how it's working for the trauma, how it's controlling the all the menstrual problems. So for all the unmarried female, whatever they are having problem, we can always treat with the gallbladder 41 and the triple bomb of 5. अनमेरिड फीमेल के शरीर में होने वाली सभी प्रॉब्लम्स के लिए हम ये बेस्ट है, हालांकि हम मैरिड अनमैरिड दोनों के लिए यूज करते हैं, एंड इट्स अ वेरी वेरी इफेक्टिव फॉर द ल्यूकोरिया और द वाइट डिस्चार्ज फॉर एनी फीमेल, राइट? So it's one of the great point, and with the help of this point, we can treat lots of things, right? So now it is calming down the genital energy. ये genital part के पास की energies को calm down करता है. It's calming down the energies here. If the person is having very very excessive sexual desire, that might be due to liver heat or some other cause, we can help the person, and with the help of this we can balance the mind and emotions, right? So it will work on the unwanted excessive sexual desire. So it will drain the unwanted liver heat, it will drain the unwanted energies from the gallbladder, and will balance this condition. ये इस condition को balance कर देगा, right? So ultimately, this is a very good point. This was the discussion of डाई चैनल. ये हमारे डाई चैनल का डिस्कशन था. इसके साथ ही हमारा डाई चैनल समाप्त होता है. अब हम एक काम करते हैं, आज बुधवार है, शुक्रवार को हम रखते हैं आपका टेस्ट, नहीं मंडे भी रखते हैं. चलो, फ्राइडे आई विल बिजी. Our next class will be on Monday because I am going to Hyderabad for workshop. Monday will be test and class. So thank you so much. Let's close the session.